Let's face it, trying to find the answers to your specific Medicare questions can be an overwhelming and time-consuming task. All of the information you need is out there online and on social media, but how do you actually cut through the noise and the conflicting information to find what you actually need to know?
I'm really confused right now.
Well, my name is Cameron Giardini, and at our independent Medicare-focused insurance agency, we often find that many of the people we talk to on a day-to-day basis have similar questions when it comes to Medicare. So, in today's video, we will be answering some of the top questions that we have received from you, our viewers here on YouTube and also on TikTok. We will focus on giving straightforward answers that will simplify your Medicare journey. Now, if you want your specific questions answered in future videos, as well as right now, please make sure to comment them below this video, and we will answer them so that both you and your peers can benefit. Now, jumping into our first viewer question, it is, how can I get quotes for Medicare Advantage and Medigap coverage without having to give out my phone number and other personal information? This is a very common question that we receive from people on social media, since unlike when it comes to most birthdays, which mean presents, birthday cake, and spending time with your family, as you approach Medicare eligibility at age 65, instead you are bombarded by mail, phone calls, online advertisements, and even people showing up at your house trying to sell you different Medicare coverages. In fact, as you have probably already seen, many of the advertisements begin at least 1 year before you even turn 65, and they simply do not stop even when you do turn 65. To avoid adding fuel to this advertising fire, let's quickly talk about some of the examples of the wrong way to get Medicare quotes. First, please avoid any generic websites offering quotes in exchange for information like your address, your full name, and even your phone number. Here on the screen, you can see some examples of what these websites might look like. In addition to these websites asking you for your personal information, we are sure that you have seen countless ads on social media sites like Facebook that are aimed at trying to get you to enter your personal information in exchange for Medicare quotes, just like you can see some examples right here. Now, last but not least, in addition to people trying to collect your information online, you will also likely receive generic postcards in your mailbox, such as these, which seem somewhat official, and they try to make it seem like there are Medicare benefits you're missing out on, or benefits that you might be eligible for that are new. When in reality, they are just trying to confuse you into giving out your permission to be contacted by an insurance agent to be sold a product. Now, as a good rule of thumb, if you have to give out your phone number in exchange for Medicare Advantage or Medicare supplement quotes online or via a postcard that is mailed to you, simply do not do it.
It's not worth it.
The main problem with using these generic sources for Medicare coverage quotes is, in fact, that you will open yourself up to dozens of phone calls from agents working for the companies that make these ads and their websites, or even worse than that, oftentimes the information that you put into these online forms or these postcards, they will simply be sold to random insurance agents in your area or across the country, and then they will contact you to try to sell you Medicare Advantage or Medigap plans. Now, don't get us wrong, there are plenty of good, quality, hardworking insurance brokers that are buying these leads with your information on them, but the problem is you simply do not know who you're going to be connected with. So, in our opinion, it's not worth the risk. In addition to avoiding filling out your information in these forms, if you are being bombarded by unknown phone calls about Medicare, we always suggest that you add yourself to the National Do Not Call Registry, or simply don't answer your phone for unknown phone calls. Since we have mentioned where to avoid getting quotes for Medicare coverage, aside from using a good independent broker, where can you go to find the right information that you're actually looking for on your own without exposing yourself to extra phone calls and harassment? That is exactly what we will show you right now. First, let's talk about where to find Medicare Advantage quotes and options that are available to you. Medicare Advantage plans, they are often called Part C of Medicare, although they are not actually a part of original Medicare, and instead they are a private alternative to Medicare, and they are provided by many different private insurance companies. Now, when it comes to seeing all of your Medicare Advantage plan options that are available in your county, look no further than the official Medicare.gov website, and specifically the Plan Finder tool that it provides. Now, please make sure not to fall into the trap of looking at other websites like Medicare.com. They are not affiliated with a government or with Medicare in any way, and they are simply designed to trick you. However, when using the online Medicare Plan Finder tool, ultimately you will end up with all of the Medicare Advantage Advantage plans that are being offered in your zip code. You can filter these results by the insurance company, the star rating of the plan, whether or not they are special needs plans, and much more. For a more step-by-step guide for actually using this plan finder tool, you can go to the 12-minute mark in this previous video that we posted. It also discusses the additional factors when it comes to choosing a Medicare Advantage plan, like considering provider networks, prescription drug coverage, and the possible extra benefits they might provide. Now let's shift our focus from Medicare Advantage plans and talk about finding quotes for Medicare supplements, which we also call Medigap plans. That's the same thing. And we'll also talk about Part D prescription drug plans. So Medigap plans, they provide secondary coverage to original Medicare, and they are also provided by dozens of different private insurance companies. Medigap quotes and pricing will vary greatly based on your age, your gender, the plan letter that you are considering, and even by the zip code that you live in. Now, in the past, we frankly would have said that Medicare.gov was not even worth looking at when it comes to Medigap quotes, but that's really no longer the case. And in fact, you hardly even need a broker to get an overview of Medigap plans available in your area. And we say that as a broker. When using the Plan Finder tool and entering your zip code, you will then choose that you are looking for a Medigap policy. Double check that the zip code is correct and then click Start. At this point, you can update your pricing based on your age, your gender, and tobacco usage, and even possible household discounts that may be offered by many Medigap plans. Next, you will want to select a specific plan letter. Now remember, Medigap plans, they are standardized by plan letters, which range from A to N. For this example, we will select the most popular plan right now, which is Plan G, and then you can select View Policies. Ultimately, this will sort the different insurance companies offering Medigap plans in your zip code, and they will sort it by the monthly premiums from low to high. Now here on the screen, you can see the results from Medicare.gov compared to the actual specialized software that we pay for to have access to as insurance brokers. Now, although our quoting tool, it's a bit more precise and includes information like recent rate increases and financial ratings, Medicare.gov is pretty dang close in comparison, and it is an excellent source to begin your Medigap search. Now, of course, the premiums you pay for coverage are just one small piece of the Medigap puzzle, so make sure you watch this video for more details about how Medigap plans increase their premiums over time before deciding the plan you actually want. Last but not least, because original Medicare and Medigap plans don't provide coverage for most prescriptions that you will fill at the pharmacy, you will also want to enroll in Part D prescription drug coverage to go with your Medigap and Medicare coverage. Now, these plans, they are also provided by private insurance companies, and just like with the previous examples, the Medicare.gov Plan Finder tool, it provides an excellent resource for learning about all the Part D plans available to you. The plan that is right for you will heavily depend on your specific medications and pharmacies, so in addition to the brief overview of using the Plan Finder tool, please make sure you follow these steps in this video that we created for the specific step-by-step process to better narrow down your Part D plan options. So the bottom line is your privacy matters when it comes to learning about your Medicare options, and thankfully there has never been a better time than now to find Medicare coverage quotes with less hassle. In reality, using the methods that we just showed you, you don't even need to reach out to a broker until you have taken the time to look at these options on your own. However, price is just one small piece of the puzzle, and sorting through dozens of these options on your own will likely be far too complicated and overwhelming. So instead of calling dozens of insurance companies to narrow down your choices, we of course recommend contacting a good, trusted, independent broker that can use their expertise to quickly narrow down plan options that will work for you based on your unique wants and needs. Of course, if you need to connect with a broker, you can give us a call or you can use a link in the description below, and always remember that our services are completely free to you. Now, moving on, our second viewer question is, I am planning to move to a new state in 3 years. Should I consider that when choosing my Medicare coverage? So let's first start with the basics. When it comes to moving with original Medicare Part A and Part B, you're in luck. Your coverage will travel with you coast to coast, no matter where you move in the United States. Your Medicare coverage, it remains intact, offering the same benefits and protections that you had before. But does the same hold true for Medicare Advantage and Medicare supplement coverage? Well, You may have guessed it, but the answer is almost certainly no. First, Medicare Advantage plans, they are offered in specific service areas, which are often defined by county or state lines, as you can see here on the screen with some service area examples of actual Medicare Advantage plans. Now, in order to enroll in and to stay enrolled in a Medicare Advantage plan, you have to live in the plan's service area. So when it comes to moving after you are enrolled in a Medicare Advantage plan, there are essentially two possible outcomes. Option one, you will be moving to a new address and county that is still part of your plan's current service area, or option two, you will be moving to a new address that is outside of your current Medicare Advantage plan's service area. Let's assume that option one applies to you first. This example, of course, applies nationwide, but we will assume you currently live in our home county of Livingston County, Michigan, and you're enrolled in this Medicare Advantage plan. Then you move next door to Oakland County. Now, in this case, the same Medicare Advantage plan that you were enrolled with, it is still available in your new county. So if you would like to, you can just update your new address with the insurance company and you can keep the plan you had. However, as you can also see here, there are new Medicare Advantage plans available to you in this new county. This actually makes you eligible for what is known as a special enrollment period, which is abbreviated as SEP. As you can see here on Medicare.gov, this SEP, it would allow you to enroll in a new Medicare Advantage plan or Part D drug plan using that new residence. But what if you face option number two? You're enrolled in a Medicare Advantage plan and you move out of your plan's service area entirely. In this case, you really do not have a choice. You will not be able to continue with your current Medicare Advantage plan since plan eligibility, again, depends on you living in that plan's service area. Even if you try to hide it from the insurance company, they will eventually find out and you will be involuntarily disenrolled from your plan. Luckily, if you plan your move and plan change ahead of time, moving outside of your Medicare Advantage plan's service area will allow you a special enrollment period to enroll in a new Medicare Advantage plan or Part D plan based on your new residence, and you can do this before your actual move takes place. Make sure to pay extra attention to what I am about to say. A very important thing to know about moving outside of your Medicare Advantage plan service area is not just that you get a special enrollment period to change to a new Medicare Advantage plan, but instead, it also makes you eligible for guaranteed issue rights to enroll in a Medicare supplement plan without answering health questions or taking into account your pre-existing conditions. And depending on when you were first eligible for Medicare, you can enroll in a Medigap Plan F or a Plan G using this method. For example, we have had clients in the past that have had Medicare Advantage coverage and then they move to be closer to family as their health worsens, and they are able to be greatly helped by using guaranteed issue rights to enroll in a Medigap plan to help cover their growing medical costs. Just remember, your guaranteed issue rights, they only last up to 63 days after your Medicare Advantage coverage ends due to moving outside of your plan's service area, so do not let this opportunity pass you by. Overall, once you're sure that you're moving, you will want to notify your Medicare Advantage plan ahead of time so you have the proper amount of time to use that special enrollment period to avoid unnecessary gaps in coverage, and you can see some examples here from Medicare for the timeline. Now, what about those of you with Medicare supplement policies that will be moving in the future? Luckily, this is more straightforward than moving with Medicare Advantage plans because Medigap plans are portable. This means that you can take your plan with you when you move and you will still have the same coverage that you had before the move. For example, if you have a Plan N in your current state, you will still have that Plan N when you're moving to a new state. However, it does not mean that there are not some added wrinkles to consider. Although your coverage remains the same, the monthly premium that you pay for your Medigap plan can change. This change in premiums, it will vary greatly based on the state you are moving from and to, as well as the insurance company that is providing your Medigap plan. An example we commonly encounter here in Michigan is that people will enroll in Medigap coverage and then move to a state like Florida in the future. Now, in this case, the Medigap premiums, they are generally higher in Florida compared to Michigan, as you can see here. So often their Medigap premiums, they will increase to reflect the higher premiums in their new state. But this is where working with a broker can be a benefit, since some Medigap companies, they don't re-rate and change your premium simply because of a move. So we can help you find the right Medigap plan if you're moving in the future that hopefully will not change premiums just due to that move. It's also important to note, because you can keep your Medigap coverage when you move, unless you're enrolled in a Medicare Select type of Medigap plan, you are not provided guaranteed issue rights to change to a new Medigap plan like we talked about when moving with Medicare Advantage coverage. Now, last but not least, if you are enrolled in a Medigap plan, chances are you probably have a Part D plan for prescription drug coverage as well. So what happens to your Part D coverage in the event of a move? Now, you may have guessed it, but it's very similar to moving with Medicare Advantage coverage. Part D plan availability, it is also based on the service area you live in, so moving out of your plan service area will cause your current Part D plan to end and give you access to a Part D special enrollment period. However, Part D plans often have much more straightforward service areas, since a service area will likely be all of the counties in a state. So unless you're moving out of your current state, you will likely be able to keep your current Part D coverage. Of course, always check with your specific plan before moving. However, one tricky aspect of moving with Part D coverage is the fact that often the new state you're moving to, it will have Part D coverage with the same insurance company with the same name that is being offered, although it is still a different plan. For example, if someone is enrolled in the Part D plan that you can see here on the screen and then they move out of state, nearby to Indianapolis in this example, you can see that the plan with the same exact name is offered in the new county and zip code, but this is not actually the same plan. Since you can see the specific plan ID code is different when compared to the plan offered in the previous state. So even if you want to keep your plan with the same name, with the same insurance company, you will still want to plan accordingly to apply for that new Part D plan when moving out of your current plan's service area to avoid gaps in coverage. Moving is already hectic enough, and as you can see, there are a decent amount of moving parts when it comes to your Medicare coverage and changing residences. So please make sure to plan ahead and connect with an independent broker that can help make these changes as seamlessly as possible. All right, let's move on to our third and final listener question, which we will be answering in this video. This question is, I have good health coverage through a company with 14 employees. Do I still have to pay for Part B? Now, real quick, before answering this question, please do not forget to like and subscribe to our channel, and don't forget to comment below with any Medicare related questions that you have. Thank you for doing that. So more than ever, it seems that people are working past age 65 and then they find themselves wondering if they can save on monthly premiums by delaying Medicare Part B enrollment. Remember, Part A of Medicare is premium free for most people, but Part B of Original Medicare does come with a base monthly premium of at least $174.70 per month in 2024 for all consumers, and it can be even higher based on your income. So if you're a high income earner, or you simply have good employer coverage, it might make sense for you to delay Medicare Part B past age 65 when you are first eligible for Medicare so you can save on those monthly Part B premiums. Now, your ability to properly delay Medicare Part B, it comes down to whether or not you will continue to be covered past age 65 by active group employer health coverage through your current employment or a spouse's current employment. However, the size of the employer providing the coverage will also be crucial when it comes to deciding if you should delay Medicare Part B or not. The magic number for delaying Part B due to active employer coverage is 20. This number refers to the number of employees that the employer providing the group health plan has. Now, there are many misconceptions about how this 20 employee threshold is determined, so we will address those right now. First, the 20 employee threshold, it is based on the number of employees and not the number of people actually covered by the group health plan. Also, both part-time and full-time employees are counted towards this 20 employee threshold. Your employer health insurance, it may even meet the 20 employee threshold if they are part of a multi-employer plan with one of the employers having 20 or more employees. Here on the screen, you can see the technical guidelines for this threshold that were released by the Centers for Medicare Medicare and Medicaid services. But in reality, it is really not for you to figure out. Instead, you should reach out to your company's HR department to see if the company's health insurance coverage is above or below that magic 20 employee threshold. Now, the reason this 20 employee threshold is so important is not because of the Part B penalty like a lot of people think. In fact, you can see here on Medicare.gov that you won't pay a Part B penalty for delaying Medicare due to active employer coverage, regardless of the employer size. Now, instead, the 20 employee threshold, it is crucial to understand because it directly impacts how your employer health coverage will coordinate with Medicare. If your active employer coverage meets the 20 employee threshold, then your employer coverage will continue to be your primary coverage even when you become eligible for Medicare at age 65. This will likely allow you to delay Medicare Part B past age 65 with no issues. On the other hand, if the employer providing your group health coverage is below the 20 employee threshold, Medicare would then become the primary payer, with your employer coverage becoming the secondary payer when you're first eligible for Medicare at age 65. Now, this change with your employer coverage becoming the secondary payer, it happens whether or not you apply for Part B. The reason this can impact you and your wallet is because when your employer coverage becomes secondary coverage, if you don't have both Medicare Part A and Part B in place as proper primary coverage, your employer coverage may only cover a small portion of your medical bills or possibly not cover some of the medical claims and medical bills that you receive. Like always, don't just take our word for it. You can see right here on Medicare.gov that not signing up for Part A and Part B of Medicare with small employer coverage, it can result in your employer health insurance not covering the cost of services that you get. In addition to that, here on the screen are some actual letters our clients have received in regards to Medicare coverage from an employer that has a plan below the 20 employee threshold. Now, like with all things when it comes to Medicare, just know that there may be exceptions to the rule when it comes to small employers, and some may still choose to pay as primary if they would like to, even after you're eligible for Medicare. So of course, instead of making any assumptions, always check with either your employer or your plan documents like your evidence of coverage to see exactly how your employer coverage will work with Medicare as far as who is primary and who is secondary before making a final decision for your enrollment. Opting out of Part B because you have employer coverage might seem like a cost-saving move, but it can actually leave you vulnerable again if your coverage doesn't meet the 20 employee threshold. Without Part B, you could face significant gaps in coverage and potential bills for services that should have been covered by Medicare as proper primary coverage. We know this is a confusing topic and we don't want to add too much fuel to the fire, but just know that if you are eligible for Medicare before age 65, the 20 employee threshold, it actually becomes a 100 employee threshold, as you can see here. There are also other unique rules for those with Medicare before age 65 due to end-stage renal disease, but that's a topic for another day, and we will link to the Medicare guide for who pays first in the description below, so you can always check that out. If you're working past age 65 and juggling Medicare versus employer coverage, you can also use our online comparison tool for comparing employer coverage costs to Medicare. We will link this in the description below the video, or of course, if you have any questions about your Medicare options, just comment below so we can help. At Giardini Medicare and on our YouTube channel, we are here to try to answer any questions that you may have about Medicare, so don't forget to comment any specific Medicare questions you have below this video. That way we can answer them in the comment section and possibly feature them in our next Q&A episode to help out others.